to finish. All the best. Next.
Dr. Athira, Goudaman, free paper 111.
These three people have a parallel poster presentation, so they are coming ahead. Then we'll go according to the...
Good afternoon all. Today I'll be presenting my paper titled Knowledge, Attitude and Practice Pattern of Contact Lens Wear Among Medical Students. Around 140 million people are using contact lens worldwide. As the number of contact lens wearers are increasing, assessment of knowledge and attitude regarding contact lens wear can aid in understanding the deficits and strengthen those areas when it comes to practice. My objective is to assess the knowledge, attitude and practice pattern of contact lens wear among medical students. This was a cross-sectional study conducted among 75 MBBS students including interns using a well-structured questionnaire. This is my questionnaire containing 4 sections, with section A containing 8 questions on demographic and general details, section B containing 12 questions on knowledge, section C contained 13 questions on attitude, and section D with 13 questions on practice. And it was scored as excellent, good, average and poor. P less than 0.05 was considered significant. Out of 75 participants, 27% belonged to final year and 16% were interns. 59% belonged to the age group 19 to 22 years and 41% belonged to 23 to 25 years. 97% were using soft contact lenses, 83% were occasional contact lens users, whereas 17% were regular users. 57% were using monthly disposable lenses, 29% were wearing daily wear type, and 15% were wearing weekly disposable lenses. Duration of contact lens use, 53% were using for a duration of less than 1 year, whereas 11% were using lenses for more than 4 years. 57% were using lenses for refractive error correction, whereas 43% were using mainly for cosmetic purpose. 73% of the students had purchased contact lenses online at least once. Barriers of using contact lenses regularly by occasional users, 44% had satisfaction with spectacles, 42% had fear of side effects, 13% had cost constraints, and 1% had lack of adequate information. Daily duration of contact lens wear, 56% were using for less than 8 hours daily, and 11% were using for more than 16 hours. On assessing knowledge, 97% students knew that washing hands is important with soap before and after handling contact lenses. 88% knew that cleaning of contact lenses is important before and after use. 68% knew that ideal daily hours of usage of contact lenses. 92% knew that lens solution has to be used for cleaning contact lenses. Only 31% knew that lens case has to be cleaned daily. 52% only knew that 3 months is the ideal duration of use of contact lens solution after opening the seal. Overall knowledge was good in 53%, average in 44%, and poor in 3%. Upon assessing the attitude, 96% felt that it is important to wash hands before handling contact lenses and to use lens solution for cleaning lenses and to consult an ophthalmologist if any eye symptoms occur after using the lenses. Overall attitude was excellent in 69%, good in 20%, average in 10%. Upon assessing the practice, 98% were washing hands before and after handling lenses, 82% were cleaning lenses before and after usage, 16% had used tap water to clean the lenses at least once, 8% were using lenses during sleep, 19% were using contact lens solution beyond expiry. Upon as overall practice pattern was excellent in 42%, good in 37%, average in 16%, and poor in 4%. There was a positive correlation with p-value less than 0.001, which confirmed that positive attitude is associated with better practice outcomes. No statistical significance was seen between knowledge and attitude scores as well as knowledge and practice scores. In our study, almost all the participants had practice of washing hands before handling the lenses, similar to other studies. 82% of students clean the lenses before and after use, similar to that in the study by Mahima et al., where it was 100% in the study by Purushottam et al. Students use tap water to clean the lenses at least once in our studies, that is 16%, which was similar to studies by Mahima et al. And other studies, whereas it was only 5% in the study by Janti et al. In our study, the students who use contact lenses for more than 8 hours daily were 44%, which was comparatively lower than that in the study by Venkatesh et al. Students who slept with contact lenses on was found to be 8% in our study, which was in contrast to other studies. Only 52% were aware that lens solution can be used for 3 months once a seal is broken, which was similar to the study by Venkatesh et al. In our study, 73% students were purchasing lenses online, which is a concern, suggesting that even students with good knowledge does not appreciate risk of online purchasing. Although there are several KP studies on contact lens use among medical students, the studies assessing correlation between knowledge, attitude, and practice patterns were not available. In our study, we found that positive attitude is associated with better practice outcomes. Even in knowledgeable users like medical students, there is lack of proper practice in spite of good attitude, which can increase the risk of complications associated with the contact lens wear. This can affect the knowledge they provide to the general population as a future care providers. So there is a need for targeted education interventions regarding proper contact lens use, hygiene and complications among medical students to ensure safe contact lens use practices. These are my references. Thank you.
Good presentation.
Thank you.
Again, as sir told for the previous speaker, your slides have to be better.
Yes, ma'am.
And font size you have to take care of. And also the background colors which you are using. No, you are using very light colors, pastel colors. So
Yes,
you should be using little darker, brighter colors.
Yes,
Okay, that is one thing. And about the questionnaire, where did you take the questionnaire from? That you have to mention.
Okay, ma'am.
Where was it taken?
Ma'am, from the previous studies, from the previous knowledge attitude practice studies, I've taken the questionnaire.
Have you taken permission to use that questionnaire? Because you are supposed to get permission from the person who has developed that questionnaire before doing a study. Was that done?
Okay, ma'am. No.
Okay, that has to be taken care of.
Okay, ma'am.
And you must also acknowledge them. Thank you.
Okay. Thank you, sir.
How many of you are representing the speaker because the speaker could not come? Or is it all speakers only who are going to present? Sure? Okay. Thank you, ma.